Bismillahirrahmanirrahim. Assalamu alaikum. A 28-year-old man is brought to the emergency department after a high-speed motor vehicle collision in which he was the restrained driver. The patient is awake and has left chest pain and vague abdominal discomfort. Blood pressure is 114 by 74 and pulse is 112. Physical examination shows chest and abdominal ecchymosis and tenderness in the distribution of the seat belt. Breath sound are equal bilaterally. Heart sound are normal. The abdomen is mildly tender. Chest X-ray reveal a left sex rib fracture without pneumothorax. Focus assessment with sonography is negative for free abdominal fluid. CT scan of the abdomen shows thickened proximal small bowel and small mesenteric hematoma. The patient is hospitalized for monitoring and supportive care. Over the next 24 hours, he developed worsening abdominal pain, nausea, vomiting, and abdominal tenderness with guarding. Repeat CT scan of the abdomen is shown in the image below. So this is the CT scan, repeat CT scan of the patient. So they are asking that which of the following is the best next step in management of this patient. So this patient is 28-year-old man. He is brought to the emergency department after a high-speed motor vehicle collision. The patient is awake and has left chest pain and vague abdominal discomfort. On physical examination, is unremarkable without ecchymosis on the area of the seat belt. The breath sound are equal bilaterally. There is on X-ray there is left sex rib fracture without pneumothorax. The fast scan is negative for free fluid. CT scan show thickened proximal small bowel and small mesenteric hematoma. Over the next 24 hours for observation, he developed worsening abdominal pain, nausea, vomiting, and abdominal tenderness with guarding. So based on these hints and the CT scan shown here, I will highlight here that this is free air under the diaphragm. The diagnosis of this question is perforated viscus and here the correct option is choice D, surgical emergent surgical exploration. So blunt abdominal trauma can cause gastrointestinal perforation and in acute or delayed fashion, for example, progression of bowel contusion, mesenteric ischemia. As this patient having on the initial CT scan, this patient having thickened proximal small bowel and small mesenteric hematoma, which can lead to free air under the diaphragm and perforated viscus. So on such cases of the perforated viscus, the surgical emergency should promote emergent surgical exploration in such cases of perforated viscus. So here the correct option is choice D, surgical exploration. I will show the photo of the free air under the diaphragm. So on the right side, here is the CT scan of this patient, which show that there is intraperitoneal free air under diaphragm. Here is the gallbladder, I will highlight here, and here is the subscapular hematoma. The red one is the subscapular hematoma, and the blue one is intraperitoneal free air, which is due to perforated viscus. Come to the incorrect one, choice A, diagnostic peritoneal lavage. So as we already know that diagnostic peritoneal lavage has been largely reduced, and this patient has clear evidence of GA perforation, indicated the need for emergent surgical intervention rather than diagnostic peritoneal lavage. Choice B, increased analgesia and close observation. So increased analgesia and close observation, as we already know that this patient has perforated viscus, where on CT scan there is the free air under the diaphragm. So increased analgesia and close observation will harmful to the patient. Choice C, mesenteric angiography. So mesenteric angiography is used to evaluate the blood supply to the small and large intestine in case of suspected injury, occlusion, or bleeding. This patient has clear-cut perforated viscus, so no need to do mesenteric angiography. Choice E, upper gastrointestinal series. So in upper gastrointestinal series uses contrast to outline the lumen of the upper GI tract and depending on the exact location of this patient perforation. which may demonstrate contrast leaking to the perforation. This study is time consuming and unnecessary because the diagnosis of perforation has already been established by the CT scan. Thank you.